عليكم ورحمة الله وبركاته. My name is Raghad from Almutairi. I'm a pharmacy graduate from University of Rahman University. Today I'm presenting Ticagrelor-induced dyspnea in acute coronary syndrome patient and its effect on treatment compliance in Riyadh, Saudi Arabia. This study was conducted at Dr. Sulaiman Al-Habib Hospital in Riyadh City. Ticagrelor is a reversible B2Y12 receptor antagonist used to prevent thrombosis that may lead to cardiovascular event among patients with acute coronary syndrome. Besides the beneficial effect of the ticagrelor, dyspnea is one of the primary concerns that affect the patient adherence therapy. The underlying mechanism of the dyspnea is hypothesized to involve the inhibition of the adenosine level, and that maybe increase the circulation of adenosine level and maybe affect that lead to bronchospasm. What we want to achieve from this study that to investigate the prevalence of the dyspnea induced by ticagrelor and to identify the onset of dyspnea appearance and to determine how dyspnea impacts adherence to the ticagrelor therapy. In period between July to October 2019, an observational retrospective study was carried out in cardiology clinic and coronary care unit at Dr. Sulaiman Al-Habib Hospital in Riyadh City. A total of 55 patients treated with a ticagrelor were identified, of whom 33 met the inclusion criteria, and the data was collected by the telephone questionnaire and the patient file reviews. For the inclusion criteria, the eligible patients were those aged between 43 to 81 years old, diagnosed with acute coronary syndrome, and taking ticagrelor 90 mg twice daily was initiated. And for the exclusion criteria, patients with other established causes of dyspnea and initiation of ticagrelor therapy were excluded. As we can see in the table, the demographical and clinical characteristic. The characteristic was age and asthma and coronary obstructive pulmonary disease and percutaneous coronary intervention and the myocardial infarction, diabetes and hypertension. The age was 43 to 81 and the percent was 57 to 10.35, and the asthma 3 patients, the percent was 9.1, and the COPD and the other who have dyspnea, they observed from 1 to 2 for weeks. As we can also hear, the dyspnea was experienced by 48.5, that 95% confidence interval, 30.8% to 66.5%, and the proportion of the medication discontinuation due to the dyspnea was 21%, the 95% confidence interval 9.0% to 38.9%. A significant proportion of the ticagrelor-induced dyspnea case was observed in patients with acute coronary syndrome, leading to notable the rate of the medication discontinuation. Additionally, 50 of these dyspnea cases occurred within the first 24 hours of initiation of the ticagrelor. There are further the larger scale studies that needed to better understand the clinical significance of these adverse effects and to identify optimal management strategy for patients on ticagrelor. And in the end, thank you for your listening. It was 0 and the percutaneous coronary intervention 30 patients, the percent was 90.9. The myocardial infarction 21 patients, the percent 63.6, and for the diabetes 9 patients, the percent 27.3, and the hypertension 13 patients, and the percent was 39.4, and the total of the patient was 33. As we can see here, the patient experience with dyspnea was 48.5%, that was 16 out of 33 patients. And those who was not experienced with dyspnea, 51.5%, that was total of that 17 out of 33 patients. and the half of the patient caused with the dyspnea half of the patients with dyspnea of the first 24 hours who have dyspnea, they observed from 1 to 2 for weeks. As we can also hear, the dyspnea was experienced by 48.5%, that 95% confidence interval, 30.8% to 66.5%, and the proportion of the medication discontinuation due to the dyspnea was 21%, the 95% confidence interval 9.0% to 38.9%. A significant proportion of the ticagrelor-induced dyspnea case was observed in patients with acute coronary syndrome, leading to notable the rate of the medication discontinuation. Additionally, 50 of these dyspnea cases occurred within the first 24 hours of initiation of the ticagrelor. There are further the larger scale studies that needed to better understand the clinical significance of these adverse effects and to identify optimal management strategy for patients on ticagrelor. And in the end, thank you for your listening.